Before you begin, ensure that you have all the necessary equipment for the procedure. Before you start the procedure, we will give you a brief situational history and provide any other relevant patient information. Place the sharps box within arm's reach. Thoroughly sanitize your hands. Sanitize the area for a minimum of 30 seconds and allow the area to dry. Set up a sterile working field. Open the drape. The gown. The syringe. And the midline kit. Sanitize your hands and remove the outer pair of long gloves. Next, sanitize the inner pair of gloves and then put on the sterile gloves. Ensure that the gloves are over the cuffs of your coveralls. Next, put on the sterile gown and tie it at the back. In a sterile manner, place the drape on the patient's arm. Follow the body diagram on top to properly unfold the drape. Sanitize the area for a minimum of 30 seconds and allow the area to dry. Take the time to familiarize yourself with the midline equipment kit. To ensure the midline catheter is functional, flush both lumens and clamp them. Feel for a suitable peripheral vein. Ensure you have the correct amount of lidocaine, and remove the air from the syringe. Inject lidocaine under the skin over the location of the vein, and then discard the needle into the sharps box. Attach the echogenic needle with the syringe and insert it into the vein. To confirm the needle is in the vein, withdraw the plunger to aspirate blood. Remove the syringe, but keep the needle in the vein. Ensure to cover the opening to avoid backflow of blood and to prevent air embolism. Advance the guide wire through the needle and into the vein. As you remove the needle, leave the guide wire in the vein. Dispose of the needle in the sharps box. Thread the introducer and the dilator over the wire and stop just short of the skin. Advance them through the skin and into the vein, and withdraw the guide wire. Remove the dilator but keep the introducer in place. Insert the midline catheter and obturator into the introducer. Slowly advance the catheter into the vein. Once the required catheter length is in place, remove the peel-away introducer by pulling apart the two wings of the sheath. Slightly push the catheter forward and remove the obturator. Aspirate blood from each lumen to confirm the catheter is in the vein. Use the stabilization device to secure the catheter. Remember to obtain blood samples for laboratory testing. Place the end cap on one of the lumens and place the one-way valve onto the other. Ensure the valve is closed. Disinfect any blood from the site. Apply a transparent film dressing over the insertion site. Thoroughly sanitize your hands. Connect IV fluids. Remove the drape from the patient. Sanitize your hands and remove the sterile gloves. Sanitize your hands and remove the sterile gown. After you have finished the procedure, remember to clean up your working area and dispose of all waste into the appropriate bins. Before moving on to the next patient, sanitize your hands and change your outer pair of gloves.